Testosterone replacement therapy, or TRT, has surged in popularity over the past decade. It begs the question, why are so many people on it? Why is testosterone down? Who's it good for? And what are the side effects?
Yeah, joining us this morning to break it all down is Dr. Payal Kohli. Thanks so much for being here.
Good morning.
First of all, why is it so popular right now?
I think it's all clever marketing. So people hear that you have low testosterone, and they jump on this bandwagon. But what really I want to emphasize is that testosterone is supposed to go down as we age. Just like with menopause, with women, estrogen goes down. So having low testosterone is not abnormal. It is a normal part of healthy aging. And in fact, healthy men shouldn't be on testosterone replacement. Now, there's a subset of men who have low testosterone where the factory is broken. The testicles aren't making the testosterone, or the brain is not telling the testicles to make it. Those are the people that would benefit because they have an abnormal reason for having low testosterone.
That's kind of like a small percentage in
Very,
comparison.
very small, yeah.
How do you know if you're deficient in testosterone? And can you just get the numbers up on their own without the medical intervention?
So our testosterone as men generally peaks during adolescence. And after the age of 30 or 40, you get about a 1% decline every year. So you are going to go down as you get older. So a lot of people just check the testosterone level, but that's not what you want to do. You want to talk to your doctor about actually checking the hormone that stimulates the testosterone to see, is it a normal amount for your age, or is it, again, the factory that's really the problem?
Sure.
And if it is low and you're having abnormal side effects, a lot of people can have sexual dysfunction, people can have bone density problems, even mood problems, physical symptoms, then you may want to talk to your doctor about testosterone replacement therapy. But it's something that is a very medical decision. It's not something you should be getting from a nutritionist or your trainer at the gym or any
from
of
the
those
marketing.
types of.
Yeah, you should make that decision from a commercial that you see. So let's say you go on it. Is this something that you have to stay on now for the rest of your life, or is it, hey, you do it for a little bit, then you're done?
No, in fact, what happens when you go on testosterone is it turns off your own factory. So it suppresses your testes from making testosterone because you're taking it as a pill. So a lot of people say, well, I feel so much better on the testosterone. It's an anabolic steroid. You are going to feel better on testosterone, but it doesn't necessarily mean it's good for you. It can cause heart disease. It can cause prostate problems if you've had prostate cancer, other types of problems like sleep apnea. And then when you stop it, you get that crash where you suddenly don't have a resumption of your own testosterone always, and that can really be problematic.
I feel like we're in this world of quick fixes, right? Like, and there are ways, right, that you can try to boost your testosterone on your own by doing other lifestyle changes.
Absolutely. And so, natural remedies for testosterone work actually quite well. And it's the usual things we've talked about so many times. So eating a really good balanced diet and certain types of foods can actually be the precursors for your body to make more testosterone. Getting that exercise releases endogenous testosterone. It does all the things that testosterone does, and it stimulates our testes to make endogenous testosterone. Sleeping 7 to 9 hours a night is a really nice way to prevent age-related decline in your testosterone levels, and just making sure to keep that stress under check. Because when we're stressed out, all the other hormones sort of shut off, and the cortisol, the stress hormone, takes over.
The natural fixes to it, I think, are important. Go for a hike.
Yeah.
Yes, do some natural things. Last question for you. Side effects. We always have to talk about like the downfall, because it's not like this magic pill and there's no side effects to it.
It's so true, and it's dangerous potential side effects. So as a cardiologist, we worry about cardiovascular disease because there's been a huge signal. Now, we don't know if it's just an association. The people that take it are the ones that are more likely to have cardiovascular disease, or it's actually causing it. Prostate cancer is a big one because cancer is driven by hormones. You give the body hormones, you can increase that. Even conditions like acne, mood irritability, changes in facial hair and other growth patterns, sleep apnea. And you, again, don't know which is the chicken or the egg, because a lot of these conditions happen as we age naturally. And so is it the low testosterone causing those conditions, or is it the other way around? And so you really want to be thoughtful and mindful before you start putting synthetic hormones inside your body that can potentially increase your risk without much benefit.
Very much so.
Yeah, Dr. Kohli, as always, very interesting topic. Thank you,
know
so
everything.
much. She does. You can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.